Shock is a condition resulting from inadequate oxygen supply to the body tissues and major organs, and will accompany any injury or illness to some degree. Shock may also be caused by loss of body fluids, damage to the heart, standing still for too long, a sudden emotional shock, fear, pain, or an unpleasant experience. Follow the DRS ABCD action plan and treat the cause of shock if possible. If the casualty is conscious, lay them down and raise the legs. Comfort them, keep them warm and reassure. Do not give the casualty anything to eat or drink. Most external bleeding will be minor and usually stops within 10 minutes through the blood clotting. For minor bleeding, apply direct hand pressure to the wound until bleeding stops. Clean if necessary and then cover with a clean or sterile dressing. Sometimes though, bleeding may be life-threatening if the damaged blood vessel is large or the blood is under too much pressure for effective clotting to occur. To manage major or deadly bleeding, examine the wound for embedded objects, apply pressure to stop the bleeding, elevate if possible, restrict movement and ideally immobilise the part. A significant amount of bleeding may occur with wounds to the head and face. Bleeding is usually controlled with direct pressure, but care must be taken to avoid pressing onto a possible fractured skull.
It's all right, it's okay. It's a bit spongy.
Assess the surrounding area. If a depression, sponginess or bone fragments are felt under the skin, do not apply pressure directly onto the wound. Attempt to control the bleeding with pressure around the wound, perhaps with a donut bandage. Once a fracture of the skull has been eliminated, direct hand pressure may need to be maintained because of the difficulty of bandaging the head firmly enough to control the bleeding. To treat a person with a nosebleed, sit the casualty with the head forward. The nostrils are pinched over the soft, fleshy area at the end of the nose bone for at least 10 minutes. Instruct them to spit out any blood, breathe through the mouth, and not to blow the nose. If bleeding continues, reapply pressure for a further 10 minutes. If bleeding persists, seek medical attention. When a tooth is knocked out, control the bleeding first, and once controlled, try to save the tooth. Instruct the casualty to bite down firmly on a pad placed over the tooth socket. To preserve the tooth, it may be sucked clean or washed in the casualty's saliva or in a little milk. Water should never be used to wash the tooth, nor should the root of the tooth be handled, as it may cause the tooth to die. In the event of an amputation, firstly manage the stump by applying direct pressure and elevation, then provide rest and reassurance to the casualty. Manage shock, then care for the amputated body part. Retrieve the part and place it in a sealed plastic bag without washing, labelled with name of the casualty and the time of amputation. Place the sealed plastic bag into a container of water and ice and transport with the casualty. When a foreign object, such as a knife, glass, branch or stick, is embedded in a wound, do not remove the object as it may be acting as a plug. Apply pressure around the object using a donut bandage. Penetrating, embedded or puncture wounds and any bites have a high risk of becoming infected, and medical treatment needs to be sought.